Thank you, Dr. B, for joining me today. Appreciate your time.
My pleasure. Thanks for having me.
This topic is about how to request that your GP include the craniocervical junction on an MRI. And when we speak about MRI, we're thinking of a recumbent MRI or lay down position. Could you identify what a patient could ask and request their GP for to add to the requisition to provide a more comprehensive view of the craniocervical junction in the three planes and why or how this is helpful?
Certainly, yes. So we're three-dimensional beings. We have 7 vertebrae in our cervical spine, and conventionally, or what would be considered a routine cervical spine MRI, um, includes a side-to-side slicing. So it'll go from left to right or right to left. It will include partway into the brain, and it'll also then include the entire neck, and it'll generally include the top 3 or 4 vertebrae in the mid-back. So you've got more than the neck in that field of view from left to right slicing. So that's let's call that the X plane. Then you've got the Y plane, which would be slicing from top down, being able to look inside your spinal canal. Because there are no discs between the skull and C1 and between C1 and C2, that upper region of the cervical spine, routinely or conventionally, is omitted from the top down or the Y plane view. And so imaging generally starts at the bottom of C2, because between C2 and C3 there's a disc. So it'll go from there, and it'll actually then go further down and probably catch the first 3 or 4 vertebrae in the mid-back as well, but it will omit the upper neck. So the craniocervical junction is omitted in that top-down view, which is called the axial plane. The side-to-side is called sagittal. And then you have a third plane of view, because we're three-dimensional beings, and that would be the front to back slicing. And that's called a coronal view. And that one is generally completely omitted. And so when you have a cervical spine routine MRI, it's side to side, including, above the neck and below the neck and the neck as well. Then you have the top down slicing, which omits the upper neck and just focuses on where the discs are. And then the front to back slicing is not even generally done. So the best thing to have any GP request when they're requesting a cervical spine MRI on a patient, especially a patient that is suspected to have issues arising in the craniocervical region or craniocervical junction region, is for the doctor to put down cervical spine MRI in the sagittal, axial, and coronal planes, so all 3 planes, and then all 3 planes must include the craniocervical junction. So by default, they'll include the rest of the cervical spine, but in order for them to crop the area of interest to include the craniocervical junction, that needs to be specifically requested in the requisition. So cervical spine MRI, all 3 planes, and then the doctor should list them: sagittal, axial, and coronal, so that there's no misinterpretation. And all 3 planes must include the craniocervical junction.
Thank you. That's so helpful for patients who are trying to establish Canadian imaging, public pay to start. We talk about private pay imaging as well and other options in Canada and outside in our full video, which you can see on Dr. B's Injury Resources site, YouTube channel, and also Craniocervical Canada. Thanks, Dr. B, for your time today. Very much appreciated.